Hello, and welcome to the Keep It Real Health Education series. In this episode, we're going to be discussing how to improve your sleep. My name is Dale Collins, and I'll be your host. I'm an exercise physiologist, strength coach, writer, speaker, and researcher with over 2 decades of experience in the fitness industry. I have a master's degree in exercise physiology and biochemistry, and I'm a doctoral candidate in health and human performance. Sleep plays a major role in your health. Insufficient sleep has been shown to increase obesity in children by 89% and in adults by 55%. In fact, getting less than 7 to 8 hours of sleep increases your risk of heart disease and developing type 2 diabetes. When you sleep, your body actually has time to be able to secrete hormones, to repair muscle, repair tissue, and even decrease the amount of swelling in certain areas of your body that are loaded and upright during the day. So getting the proper amount of sleep affects appetite regulation hormones, affects glucose tolerance, lean mass, and even your dietary intake. Surprisingly, many studies more recently have shown that actual teenagers need far more sleep than adults. So females 8 to 15 and males 9 to 16 actually need between 9 and 10 hours of sleep a night, where most younger adults, 15 to 21 in females, 16 to 23 in males, need between 8 to 10 hours of sleep. Your body's been shown to have a natural circadian rhythm, meaning it understands daylight and nighttime. And these things can affect your brain, body, and hormones and affect your ability to sleep. So getting light during the day helps reinforce that circadian rhythm and also helps your body understand when to go to sleep at night. So if you're not outside getting a lot of normal sunlight, it can actually affect your body's ability to fall asleep. It can, in some cases, lead to insomnia. So getting natural sunlight or even artificial bright light can actually help your body learn when to go to sleep and learn to go to sleep quicker and easier than if you did not get that light during the day. Unfortunately, getting a lot of exposure to light in the evening, most of all what we call blue light, which is from electronic devices, has been known to kind of trick the body and the brain into thinking it's in daytime. With that, it also means it impedes your body's ability to go to sleep. So the recommendation is to turn off those devices with bright lights or dim them down at least 2 hours before you go to bed. There are glasses that can actually reduce the amount of blue light coming into your body so you're less affected, but trying to limit some of that activity on screen will help your body be able to wind down and understand when to go to sleep and get to sleep a lot easier. The use of caffeine in the United States has significantly increased over the years, and upwards of 90% of the US population uses caffeine on a daily basis. However, caffeine impedes your body's ability to unwind and go to sleep. So consuming caffeine up to 6 hours before bed can actually reduce your sleep quality and limit your ability to get to sleep. So usually the recommendation is don't have any caffeine after about 3 to 4 p.m. depending upon when you tend to go to bed. You can also switch to something like decaffeinated coffee if you want to have something later in the afternoon or evening, so your body won't absorb any caffeine and can still work towards getting to sleep at the right time. So caffeine is a stimulant. What it does is it gives you mental acuity, hypes up the brain. Unfortunately, that hyped up brain has trouble getting to sleep. It can also lead to insomnia, meaning you go to bed at your normal time. However, your brain's still up and active, has trouble getting to sleep, which is going to impede your body's ability to recover, recharge, and feel rested. While sleeping at night is the best, small naps throughout the day can also help your body. Usually we recommend 30 minutes or less during the daytime because naps longer than that can actually influence your health and sleep quality later at night. So if you have to take a daytime nap, try to make sure it's limited to roughly 30 minutes. And for some people, having that little siesta or that small nap midday helps augment the fact that they may not be getting enough sleep at night. So naps are okay, just don't have them too long or too late in the day where they will influence your body's ability to fall asleep at night. Your body likes to be on a normal or regular schedule, especially for sleeping. And this goes along with the circadian rhythm of sunrise and sunset. So if you find that you are outside of that rhythm, especially if it's work, developing a new natural cycle becomes very important. Having a regular sleep pattern or regular sleep cycle goes a long way towards what we call sleep hygiene, making sure that you have the proper conditions to go to sleep. So if you're going to bed really late on the weekends, waking up really late on the weekends compared to your normal day, it can affect your work week schedule and your work week sleep patterns. Trying to make sure you do the same things day in, day out within reason can help make sure that your body has a normal schedule that it understands and can stick to help you sleep at night. For some individuals, especially with insomnia, taking melatonin can be one of the easiest and more natural ways to help them fall asleep at night. Usually 1 to 5 milligrams 30 to 60 minutes before bedtime can help the body unwind and get to sleep a little bit easier. If you're unsure, please check with your healthcare provider to make sure that this is a good alternative for you. But for most cases, this can be purchased over the counter as an easy way to help your body unwind and get to sleep. While melatonin is the most common, there are other supplements that have been shown to improve sleep. Everyone is different, so take a look at the different types of supplements listed. You can try one, you can try others, see what works the best for you. Obviously, most of these are all natural supplements, so they're not going to have heavy side effects like a lot of other things can. Usually with these, they're going to help your body relax in order to help you get into that sleep phase a little bit faster. And that's one of the big issues with this is allowing your body the ability to unwind and get ready to sleep. One of the biggest things with that is having a consistent pattern to sleep, making sure that you're being consistent with the conditions of sleep. Alcohol can also affect your body's ability to produce melatonin and your circadian rhythm. So typically we don't see this as much when we're younger. As we get older, the alcohol actually has a greater effect, and it can affect your circadian rhythm and your human growth hormone production, meaning it will make it tougher to get to sleep and tougher to stay asleep throughout the night. As we touched on earlier, making sure your environment is consistent, meaning making sure you have very little external light or noise, making sure your temperature is set about 72 degrees. All of these things, having a quiet, peaceful, relaxing environment can help you get to sleep. And this is part of what we call sleep hygiene. It needs to be consistent, meaning if you find that you are someplace where there's a lot of light compared to your room, you're going to see you have trouble getting to sleep. If there's a lot of external noise, if the temperature's too high, if the temperature's too low, all of these things can affect your environment and your ability to get to sleep. Many of you have probably experienced in the summer or winter too hot, too cold, and how it affects your quality of sleep throughout the night. Having a set temperature, 70, 72 degrees, seems to be about optimum for most people. You don't want to be too hot, you don't want to be sweating in bed, but you don't want to be cold or shivering. So a cool environment tends to work better, and then you regulate that with the amount of sheets or blankets on the bed to find that happy temperature spot for you. And this can be very different for you and your spouse, but understand that starting with a little bit cooler temperature is going to make it so you can regulate your environment a bit better and sleep better. Eating late at night or snacking late at night can have a significant effect on your body's melatonin production and human growth hormone production. Usually it's recommended to wait 4 hours after you finished your meal before you go to bed. This is going to allow the body a chance to actually break the food down, the food to pass from your stomach to your lower intestine, and decrease the chance of gastric reflux or heartburn. All of these things, if your stomach's a little upset, if you feel like things might come up, will greatly affect your sleep quality and your ability to get to sleep at night. Another aspect of sleep hygiene is having a sleep routine, meaning having set things to do in order to help your body understand it's time to wind down, it's time to shut things down and go to sleep. And this can be anything from reading a book, taking a hot bath, deep breathing, visualization. See what works for you. For a lot of people, reading right before bed is going to help their body unwind. It's going to take their mind off of the stresses of the day. It's going to allow it to slowly wind down and then go to sleep. Also, reading a book is going to get rid of any blue light, meaning it's going to take away from that screen time before you go to sleep. And if you do these things on a consistent basis, your body starts to understand now is the time to let go and prepare for sleep. Taking a warm bath or shower roughly 90 minutes before bedtime can help improve sleep quality and help you get into a deeper sleep state. Obviously, we don't want this to be necessarily a full shower, but just using the hot water to help the muscles relax and release. Let your mind relax and release. Not right before bed, just because that's going to up your body temperature and that can make it a little more challenging to get to sleep. But just the relaxing effect of a bath or shower can help a lot of people unwind from the day, prepare their body for sleep at night. Insomnia is not the only problem with sleep that happens to some individuals. One of the most common is sleep apnea, which is actually inconsistent or interrupted breathing while they sleep. And some reviews have shown this is upwards of 24% of men, 9% of women have some sort of sleep apnea or sleep disorder. This is going to make sleeping not just difficult, it's going to affect the quality of the sleep. So a lot of times you may hear your partner suddenly gasp in the middle of the night. You may hear larger breathing sounds, or you may hear no breathing sound with sudden larger breathing sounds. A lot of these things are going to affect the body's ability to have a good night's rest and to actually produce the hormones it needs to stay healthy and reduce inflammation overnight. So that common breathing issue is significant for a lot of people. There are a number of things you can talk to your doctor about. If you think you have sleep apnea, there are tests that can be performed. If you think you or someone you know may be struggling with this, talk to your healthcare provider because it will affect all areas of their life if they're not getting that good quality sleep. Quite often, if you go to a hotel, you'll find that your sleep quality may be either far better or far worse than it is at home. And a lot of this has to do with the age of the mattress and also the type of the mattress. So some people like a firmer bed, some people like a softer bed. My wife and I always joke around about the fact that one of the first things we do is go sit on the bed once we get into a hotel, because it's going to tell a lot about the bed, the age of the mattress. You're going to note if you really sink into that bed, this might not be the best quality of sleep, especially if you're like me. I like a firmer mattress to sleep on. It's recommended to change out your mattress about every 5 to 8 years to make sure that you haven't actually worn into that mattress. If you look at your mattress after you're changing sheets, is there a good size indentation where the person sleeps? That shows the mattress is getting worn. You may need to flip it over. You may need to watch, because even though this is expensive, Having a good quality mattress really affects your body's ability to sleep. And if your mattress is 10, 15 years old, you're probably not getting the quality of sleep that your body needs. Getting consistent exercise also really helps affect your sleep quality and your ability to get to sleep at night. So exercising consistently has been shown to reduce a lot of the symptoms of insomnia. It's also been shown to help people fall asleep faster and get that deeper sleep that the body needs. So making sure you're consistently exercising. This doesn't always have to be a really difficult or challenging exercise routine, but one that's going to help get the blood flowing, work the muscles, work the tendons. It's going to help you sleep at night. It's going to help you recover. You just don't want to exercise right before bed. You want to give it a little bit of time, an hour or two at least, before you go to bed at night. Give your body a chance to unwind. Nocturia is the medical term for excess urination at night, and it can definitely affect your sleep quality and your energy. If you drink a lot of liquid right before bed, obviously your body needs to get rid of it. So you do need hydration, and this is the point where you maybe need to drink more water earlier in the day and then taper down in the evening before bed. Potentially even not drinking anything the last hour or two before you go to bed. Allow your body to get rid of those fluids so you don't have to get up every night. But making sure you have a good hygiene and good steady routine can help you get to sleep, can help make sure you stay asleep. Sleep is a vital part of our health. You need sleep, you need good quality and time of sleep for your body to recover every night. There's a reason why sleep deprivation is used as a torture technique. If you have prolonged sleep deprivation, it makes it very difficult to function. So make sure you're getting enough sleep. Use the tips we've gone over to help make sure you've got a cool, dark environment. You have a set routine. You're not eating too late, not drinking anything too late, and making sure that you unwind properly to help your body get to bed. Do this in a consistent routine, and you're going to find the quality of your sleep is getting better and better. If you're struggling with this, if these things don't help, you may need to talk to your doctor. You may need to talk about things like melatonin supplementation, or you may need to see if you have sleep apnea. But getting to sleep, getting good quality of sleep is going to help you feel better. It's going to help your body function better, and it's going to help your energy level throughout the day. Thank you.